Too many older people are forced to go to hospital when they're ill, when they would be better off at home, according to a report into care for the elderly in England and Wales. It's critical of what it says is the enormous variation in the way older people are cared for. Our health correspondent Sophie Hutchinson reports.
85-year-old Beryl Shepherd recovered from flu and back home to her husband. She was treated at Northern General Hospital in Sheffield. It aims to get elderly people back into the community as soon as possible.
I'm Katie, I'm one of the physiotherapists. This is Laura, one of our healthcare assistants.
So instead of doing the final assessment on the ward, it's done at home. And like many, Mrs. Shepherd is delighted to be back.
What does it feel like to be home?
Great, because I'm familiar with it and I know where everything is.
Would it be possible if we could have a walk into your hallway?
Staff say patients are more confident at home and waits to be discharged from hospital have dropped from more than 5 days to just 1. It's schemes like this that today's report says should be rolled out across England and Wales. The Commission on Improving Urgent Care for Older People says services are often ill-adapted. It says they should be driven by a person's needs and goals. There should be a single point of contact for patients, and that services need to stop simply reacting to a crisis and start trying to avoid one.
If you have a team around you that you're seeing regularly that helps you keep well and gives you advice on managing your long-term health conditions, then we know you're much more likely to stay well and less likely to fall ill enough to need to go into hospital.
And doctors in Sheffield agree. They say their home assessments are only the first step.
In Sheffield, we can now put in place the equipment, home care and ongoing rehabilitation that the patient needs in real time. And the essence of that is so important. That first night at home can be fundamentally important to optimise the chance of carrying on independently living.
The government says it's spending £5 billion on transforming services to avoid unnecessary stays in hospital for older people, something Mrs. Shepherd welcomes.
There's no place like home.
Sophie Hutchinson, BBC News.
Now, 18-year-old Jordan Cox is